Let me now welcome here on stage and for all of us just hear from Michael Morley. He's partner and regional leader of brain health for the McKinsey Health Institute. Mr. Morley, whenever you want, the floor is yours.
Thank you so much. Thank you so much for being here. It's a privilege to be with you all. And, what we want to do is imagine a world where it's able to invest holistically in your physical, mental, social, and spiritual health, not just to live longer, but to live better. And what I want to spend the next kind of 15 minutes talking about is show how investing really in what we call the brain economy or brain capital can really unlock millions of years of higher quality life worldwide. So we have the opportunity to lift, square, and extend life over the next decade. So at the McKinsey Health Institute, we aim to add life to years and years to life. Currently, life quality declines near the end of life, but we believe in what we call squaring the curve. So we can extend healthy life expectancy by enabling not just longer, but also higher quality life as well. So let's kind of look at the challenge and quantify that today. The burden of mental and substance use disorders is 330 million dailies. The mental and substance use disorders, that about half of that, 150 million, are the indirect contributors from mental health and substance use. So the way to read this is the right-hand side are the direct daily adjusted life years from self-harm, depressive disorders, anxiety disorders. But as more and more clinical research shows, those have very real, tangible impacts on physical health, on hypertension, heart disease. And so when you think of the full holistic impact of brain health, you're looking at 330 million daily adjusted life years impacted around the world. So what can we do to really improve this? What are the levers that we can really unlock this potential? So we see 5. One is to make sure that we really set a bold ambition. We really need ambitious brain health targets to unlock the quality of life that we aspire for from where we are today. Incremental thinking will not get us there. We really need cross-sector collaboration. So we need to be able to unite public, private, and social sectors. As we'll talk through, as part of the challenge of really addressing brain health effectively is that it touches so many aspects of life that you really need many different actors across the ecosystem, from education, from healthcare, from nonprofits to for-profits, to really work together. Early intervention. We really need to address issues early to improve outcomes, and we'll see a lot of brain health and conditions actually manifest quite early in life and then persist throughout. So we need ways to better address it early on where we can have more impact. The next one is to scale what works. I think when we actually look at this, about 40% of the daily adjusted life years can be actually addressed by scaling medical interventions that are proven that we know can actually help. And then finally, to do this, we need to think more innovatively on our financing mechanisms. We need to be able to secure sustainable investments in brain health. And as we'll talk about a little bit today, that is challenging, as it's a little bit more difficult to define what are the success metrics and how do you measure success when it comes to brain health. So let's talk through the first one, defining a bold vision. We need a bold vision and aspiration, not just incremental change, but really transform the entire system. So one such example of this is the Alignment for Progress's 90-90-90 vision in the US. And so this framework sets out moonshot goals that by 2033, so in 10 years, in the US, 90% of individuals are screened for mental and substance use disorders. 90% of those individuals receive evidence-based services and supports they need. And 90% of those individuals who receive treatment can manage their symptoms in recovery. This might seem ambitious, but we know it can be done. This same model was used by UNAIDS in 2014 to tackle the AIDS epidemic. So it was the same, very similar structure in 2014 was used to tackle the AIDS epidemic. And as of 2022, so 8 years later, 86% of people with HIV knew their status, 89% had access to antiretroviral treatment, and 93% of those are virally suppressed. So these dramatic improvements are possible. We just have to set similar ambitions for brain health. The second one was cross-sectoral collaboration. Systems level change requires individual and stakeholder action, and everyone has a role to play. So with the McKinsey Health Institute system mapping tool, which we helped develop in collaboration with the Kennedy Forum, we've outlined the roles that various sectors can play in improving brain health. And really, as you see, collaborative action is essential to advance a common vision for the future. As you're not just talking around healthcare stakeholders, we often talk around what do hospitals need to do, what do providers need to do. But there's a question, what do insurance companies need to do to align incentives? You have so much touch points with education, community support, and the public sector as well. And so this is part of what makes it so challenging to tackle brain health effectively. The other point is we need to start earlier. So the burden of mental and substance use disorders peaks early. So most mental health illnesses appear by age 24, and early intervention is crucial. So we need to shift from reactive preventative care for mental and substance disorders later in life to being much more proactive. And in 2022, the McKinsey Health Institute conducted a survey across 25 countries and 4 generations and found that almost 1 in 5 Gen Z worldwide reported struggling with their mental health more than any other generation. And to put that in perspective, that is 3 times more likely than the baby boomers. So between the baby boomer generation and the Gen Z generation, you've had an increase of 300%, the rate at which individuals are struggling with mental health. And this will only get exacerbated later on in life. So unfortunately, around the globe, most of our health systems are ill-equipped for prevention, detection, early intervention. But as a society, we need to build out these capabilities to intervene early and prevent mental and substance use disorders wherever and whenever we can. So let's talk a little bit about the bright side. Scaling what works. So to address the current state of mental health burden, we have to take the quick wins. We have to scale what is already clinically proven to work. When we talk about that, we're referring to hundreds of evidence-based interventions that we know work, already exist, and can solve a good portion of this crisis. They include interventions such as regular exercise, to therapeutic access like antipsychotic medication. And when we take these in totality that already exist, we can reclaim 130 million life years worldwide, which is almost about 40% of the total overall current disease burden that we shared earlier on of 330. So almost half, about 40%, we could address already if we had the incentives in place to scale what we already know clinically works. So why aren't we? Innovative financing. We've been working with private and public partners and philanthropic leaders to think through how we can inspire more innovative approaches to funding mental health interventions. Traditionally, financial returns have been less explored, given unfavorable economics and also minimal consensus on what the exact success metrics and outcomes are when we talk about brain health. Non-traditional financing methods that consider social impact and can quantify monetized ROI can therefore enable more access to effective and efficient flows of funding. So McKinsey Health Institute is one of the founding partners of the Coalition for Mental Health Investment, alongside the African Venture Philanthropy Alliance, the Clinton Global Initiative, Kokoro, and the Wellcome Trust. CMHI's vision is to address a key challenge in mental health the financing gap, which is estimated by the United for Global Mental Health at $200 billion annually. So we talk about how we address this through innovative financing. We're looking at an annual gap globally of around $200 billion, which we think needs to be allocated. This new coalition capitalized on the emergences of new funders interested in mental health and new financing models, which means that we have an opportunity to scale interventions as never before. This coalition focused on de-risking mental health investment through innovative financing, inspiring investment globally by highlighting the business case and impact on investment, and then integrating mental health into existing funding in other sectors. So we want to connect leaders from across sectors. We want to inspire them. We want to de-risk their investments with innovative financing models. And then finally, we want to kind of integrate them into existing funding streams. In conclusion, everyone stands to benefit from improving mental health and prioritizing brain capital, both to enhance individual well-being and to bring societal-level advancements and meet the rising tide of future global trends. When we prioritize brain capital, we're focusing on the rewarding aspects of great health, the joy of meaningful activities, laughter, building relationships. As we embrace this collective responsibility, we can work towards a world where everyone has the opportunity to live a healthier and more fulfilling life. In this room, I see visionary leaders, leaders at the institutions with the power to change our systems, and advocates who will continue to change the trajectory of our global mental health crisis. MHI recently collaborated with the World Economic Forum and Harris Ayer to publish an article on the impacts of brain health on the economy. If you're interested, please scan the QR code if you'd like to learn more. And thank you all so much for your time today and for all the work you're doing, each and every one of you, in advancing towards capturing a greater brain capital globally. Thank you so much.